So joints are the other thing that are really very remarkably affected by pregnancy and the hormones. The ligaments soften. This, again, has nothing to do with how far pregnant you are, although obviously as you get bigger and heavier in the third trimester, the weight-bearing joints are going to start complaining more, but the joints loosen up right away. That is great for when you go to deliver. The pelvic bones, we think of it all as one bone, but it's not. It's actually several bones with immobile joints. So when the ligaments soften, it allows those bones to stretch and bend and let the baby out. That's great. You can strain and sprain things much more easily when you're pregnant. The sacroiliac, so the low back, the joint between your tailbone and the bone you sit on will start to move and complain, and you'll start to have arthritis where you didn't even know you had joints. Hips, knees, ankles, and feet, those are the ones that are all going to start, letting you know that, ouch, things are not being held in alignment as well. When we exercise, same thing. The joints can rub incorrectly, so it's important to follow programs that take that kind of thing into account. You don't, for example, want to do things that have gravity pulling straight through your bottom and putting a ton of pressure on your back, like squats. That's not a good thing. There are other ways to do that where we take gravity out of the picture and we can slide on a sled. Baby your joints. Get in the water. The water is wonderful. Again, it lifts all the weight off your joints, and it's a great place for a pregnant woman. Massage. Massage helps. That's tell your husband, I need a massage, or he can purchase a massage for you. Warmth. I love the little heat patches. What are they called, Michael? Help me out. Yes, I'm having a senior moment. Thermacare patches. So there are those patches that you can apply that heat. And that will help people. Some women like ice better. You can do that. There's nothing wrong with that, but warmth is better. Stay away from anti-inflammatory medications. They're not something you want to use while you're pregnant. Anti-inflammatory medications are Advil, Motrin, ibuprofen, Anaprox, Aleve. So Tylenol is fine. Anything beyond that needs to be something stronger that you need to get from us, but don't take the anti-inflammatory medications. There are various exercises that you can do to help with your back. Now, don't let anyone see you do this, but you get down on all fours and you get your front end lower than the back end and you rock back and forth, and that takes all the pressure off that low back and stretches all of that out. A support belt really does help. If you think about it, it's like having an extra layer of muscle to help hold that up. And this is very small. I have a bigger one. It looks like a little, something Dr. Seuss would draw. So there are two special areas muscle-wise, which is your belly and your bottom, that have some specific changes. And I know that one's probably not much better, but so yes, there we go. My self-portrait. No, not really. The rectus abdominis muscles, those are the washboard bellies that you see on those really fit guys, normally are right here. They run in the center. When we are pregnant, eventually the path over your belly is longer than the path around it. So these muscles split and go around. That arc is shorter. That makes the physics, or I'm not sure what else to call kinesia, of doing a sit-up very, very difficult. And if you do a sit-up, you'll notice that you have this gigantic bulge right here, which is where you no longer have muscle now, and it's very thin. So those muscles split and go around, and this one's really going to be hard to see. The other place where those lovely muscles split is your bottom. So there is a set of a sling, like a hammock, that goes from your pubic bone to the sacrum and the coccyx. That's the little tailbone that kind of sticks up down here. And those muscles also, normally the opening is about like that. Well, yes, something the size of a melon is going to pass out the size of the opening the size of a quarter. And so you can see, they've got to do this and move out of the way. And oh yes, this is my son, my oldest son, and I'll confess that we're not perfect parents. How about that? I don't know what he was watching, but probably something that he shouldn't have been watching. And he asked me, or he came up to me and he said, what's the definition of a woman? I don't know. It's kind of like a knock-knock joke. And he said, well, he had been listening to this comedian. And the comedian was arguing with him about, you're not a woman, you're a girl. You're not a woman until a baby drops out your vagina and falls on your dreams. And I couldn't help myself. I had to laugh out loud because as irreverent as that sounds, and I would never say, remember he was my oldest, I would never say that he dropped on my dreams. There is a fundamental truth to that. The bodily changes that happen the first time around, especially in your bottom, are remarkable, and no, the lay of the land will never quite be the same, and we'll talk about that in a minute. Now, the good part is that the clitoris, which of course is our pleasure center, is located way up here, right under the pubic bone. And this is good because it prevents it from being run over and damaged when that baby comes out. These muscles and these muscles take 6 months to get back into their pre-pregnant position. So for 6 full months, those belly muscles aren't going to be the same, and your bottom's not going to be the same. And the reality is that in truth, as far as the bottom goes, 40% of us are likely to require a tuck or suspension of some type. Those muscles make up for it. All right. Okay. I think that's it. I think I'm done. Okay, I'll turn it over to you. Oh.